Welcome to Post-Pandemic Self-Care, What Now? And thanks for joining us. I'm Shannon Ahern, the Project Director with the Behavioral Health Partners of Metro West, and I will be facilitating tonight's webinar. We know that many people in our community and around the world have been struggling with mental health, substance use, and social needs such as housing and food security throughout the pandemic. And as things are beginning to return to a new normal, we wanted to provide an opportunity to present some local resources that people can access to support their well-being. Tonight's program has been made possible in part by generous funding from the City of Framingham and will feature presenters from Advocates, South Middlesex Opportunity Council, also known as SMOC, Spectrum Health Systems, and Wayside Youth and Family Support Network. We are working with ASL interpreters tonight, and they are Anna Nolan and Jenna Jasek. This is a webinar presentation and all videos will be off except for the presenter being spotlighted and the interpreters. We will have a brief amount of time after each presenter for questions related to their content. If anyone would like to ask a question in ASL, please send a private chat to Nicholas Jennings and he will turn on your video. All participants may also use the chat feature to ask a question at any time. As time allows, we will read them aloud for everyone and give the presenters a chance to respond. We are recording today's webinar for future viewing, and a copy of the slides presented will be shared with attendees after the event. I'd like to start off with an overview of our program at the Behavioral Health Partners of Metro West. So again, as I said, my name is Shannon Ahern. The Behavioral Health Partners of Metro West is a collaborative partnership that is comprised of Advocates, SMOC, Spectrum Health Systems, and Wayside Youth and Family Support Network. Those four agencies came together to form the Behavioral Health Partners LLC about 5 years ago. And one of the first programs that they developed was our referral line navigation and care coordination program. And I'm going to talk a little bit about that. Our navigation and care coordination line has been operating since 2017. It allows one phone number that anyone who lives in Metro West can call to get help in arranging mental health, substance use, and social service programs. Our care coordinators speak with callers to find out what their needs are and connect them to the services that best meet those needs. We stay in contact with people throughout the process until they're successfully connected with the services that are going to best support their needs. And we also coordinate with other providers that people may be involved with. We are not a crisis line, but we want to make you aware of crisis supports that are available in the community. So I'm going to talk a little bit about those. Advocates operates the emergency services program for the Metro West area. The phone number there is accessible to anyone in the Metro West area, 24 hours a day, 7 days a week, 365 days a year. Anyone that's experiencing a mental health crisis can receive support in the form of an assessment, intervention, and stabilization, and can also be connected to services that can support them on a more ongoing basis, which may include our program or other programs for direct care. For youth, Advocates works with Wayside to provide mobile crisis intervention. And Advocates also operates several jail diversion programs, which includes a co-response of a clinician going out with the police department for calls that the police may be responding to. And the jail diversion programs are available in most Metro West communities, including Framingham, Natick, and Ashland, as well as several others. Next slide, please. So a little bit in terms of how our navigation and care coordination line works. Anyone in the Metro West area can call us at our 800 number, or they can visit our website and enter their information to receive a follow-up call from us. Our care coordinators, as I mentioned, they listen, assess what the needs are, either for the person or their loved one, or if it's a provider, a person that's in their care. We also ask about preferences and offer services and supports that are personalized based on those preferences. So, we make sure that we find providers that take the insurance that you have, or if you are looking for a provider that has a particular specialty. We factor all of those things in when we're looking for resources to connect you to. We also communicate with people throughout the process, and in many cases assist in obtaining direct appointments for people. We offer options to coordinate with their primary care doctor or other providers that they're involved with to promote collaboration and integration. And most importantly, we follow up with people after they've been connected to those services and supports to make sure that they feel well matched and securely connected before we end our involvement with them. Next slide, please. In terms of frequently asked questions that we often get about our program, when can people call? Monday through Friday between 9 and 5. We can also accommodate return calls after 5 p.m. As needed. We're happy to work with people and be as flexible as possible to accommodate that. People can go on our website at any time, 24/7, to enter their information, and they'll receive a call back the next day. There's no fee for our service. It's free to anyone that's a resident of the 25 cities and towns that we cover in Metro West. Our program is physically located in Framingham, Massachusetts, but as I said, we work solely by phone, and we cover a large catchment area of 25 cities and towns. We are proud to offer a lot of diversity in terms of the languages that our care coordinators speak. In addition to English, we're able to support callers directly with care coordinators that speak Spanish, Portuguese, Arabic, as well as Moroccan and French. And we can assist callers in any language through a phone-based interpretation service. And people will often ask what insurances we take. We can work with callers that have any insurance or no insurance at all, because our program is free of charge. The insurance only impacts the types of providers that we connect them to. Next slide, please. So again, our goal is to connect people to the right support. We really pride ourselves on keeping that as our central focus and really personalizing our approach to each individual that we work with. Our 800 number is up there, and as well as our website. Feel free to go check it out. You'll find more information in addition to what I've shared tonight. And while our program is one place to get started, our partners also offer many resources, and they're going to share some of those with you tonight. So our first presenter for this evening is Lauren Mazzola, licensed mental health counselor and director of Advocates Community Counseling Clinic. Lauren.
Hi, everyone. My name is Lauren Mazzola. I oversee Advocates Community Counseling outpatient clinics. We have clinics in Framingham, Marlborough, Harvard, and Waltham. I'm going to talk a little bit about, in this ever-changing world, how can we take care of ourselves and our families, and then some of the services that Advocates offers. So it's been 16, 18, it feels like 100 months that we've been in the midst of COVID-19. What do we do now? The world is starting to reopen. Where am I at with my comfort level? What do I want to do? What do I feel safe doing with my family? Do I go to this party? Do I wear a mask? Do I not wear a mask? Do I hang out with this person? Do I not? These are some of the things that we have to think about individually as a family. and as for yourself. And wherever you're at in that process is okay, right? That's what I want to reiterate. Whatever pace you're at, it's okay. If you're not ready, that's okay. If you want to start slow, if you want to start by, I'm going to go out, I'm going to go for an outside walk with my friend to start to get out of my house a little bit, that is okay too, right? So going at your own pace, understanding yourself. And we're going to talk about if you're struggling to kind of identify that and it's affecting your daily life, who can you reach out to? What are some resources in your area to help you with that process? I worked with kids. My background is in working with children and families. And something I often talk about with people in ever-changing worlds. Kids were in school. You may have been lucky enough to work throughout this whole pandemic, this whole time, or you didn't, or you're returning to work, right? Routines are shifting. Everything is shifting, right? Was I virtual and now I'm back? Something I preach on constantly is create a routine as best as you can. Does that mean you have a schedule hung up in your kitchen and you're following this schedule to the T every day? Not necessarily, no. And not that I know I couldn't do that with my family, or me personally, I can't. But it can be something as simple as I wake up before my kids, or even with my kids whenever they're crying to get up. I have a cup of coffee. My kids know, they sit down, they watch a certain show in the morning. They have their milk, they have a pancake, and that's their routine. And they know every day I'm going to wake up and I have that pancake, or I'm going to have that cup of coffee, or I'm going to wake up 7 o'clock in the morning. I'm going to have a cup of coffee before the rest of the family gets up. Some type of routine, anything that people can, that can create that sense of balance and structure is helpful. Throughout this whole year, our parents, a lot of people that I have talked to, adults, parents, people have really been stretched thin in ways that they didn't even know that they could be stretched. So it's important to take care of your own needs in order to help other people in your family. And that doesn't have to be kids. That can be a parent, that can be a sister, that can be the elderly, an identified family, it could be the elderly person across the street. You have to put on your face mask before you can help someone else. So that's really important. Part of that too, sometimes you have to take a break from social media, right? There's so much still going on that you still see in the news that sometimes taking 2 hours, half hour, decide I'm not going to end my day on, I call it the book, Facebook, that can be healthy for people as well. Sometimes it's shutting off the news too. We see a lot of news on the Facebook, but sometimes it's just taking a break to get away from that. I know myself and a lot of people I know, my family struggled with this next section, which is maintaining healthy eating habits, right? Even as you start to get out of the world, I talked with one individual and they were saying, I hadn't been around people in so long. I've eaten so much pizza. I've eaten so much garbage just because I'm coming out of it. I'm so excited to go to barbecues, right? So part of taking care of yourself is still maintaining those healthy eating habits. Another thing to stay mindful of is unhealthy coping mechanisms. It's been a stressful year, right? We're starting to come out of it. So being mindful of how much you drink it. Are you smoking marijuana? Are you overusing marijuana? It's kind of the same concept as the person I spoke about previously was, I haven't been out with people in so long. I've just been nonstop drinking and hanging out with people. I'm really excited, but I'm starting, my mood's starting to come down a bit again. So just being mindful of where you are at. Next slide, please.
Lauren, if you could just pause one moment.
Absolutely.
Thanks so much.
Yeah. How do you support your own emotional well-being? I one time went to a training and I heard this phrase, if you can name it, you can tame it. I thought it was so cheesy, but I actually really love it. If you can name that feeling, then you can tame it. There's actually research that if you verbalize a feeling, it changes some connections in your brain and you calm down a little bit. So being able to say, going to this barbecue makes me anxious. I haven't been around that many people. Then you start to tame it. Or, you know what? I'm really anxious to go into that Target. Not everyone's wearing masks right now and I don't know what to do, right? If you name it, you can tame it. right? Understanding what you can and can't control is also important. I can't control the speed that things are starting to open up. It seems like it was a switch and all of a sudden we were wearing masks and then we weren't with them. You can't control that. You can't control what other people are doing. You can only control yourself and your own immediate family. And sometimes not even your family, let's be real. The weather is getting nice and this has been very helpful. But stay active and keep your body moving as much as you can. I know throughout this whole pandemic, there was a lot of people I talked to that they were like, I haven't left my house in like 2 weeks. There was someone I talked to that he was lucky enough, like I said, to be working this whole time. He was working virtually. He said, Lauren, I didn't leave my house for like a month. And I sat around. I don't even know how to get dressed anymore. So staying active, moving your body, anything, whether it's a walk around your block twice safely, keep moving. Staying present in the moment. I often do this activity with people I serve, where it's named 5 things I see, 5 things I smell, 5 things I feel. And when you go through that, that's automatically calming someone down and bringing them into the present. Also staying connected to your support system. This whole year has been really nonstop, where people have been so stretched thin. I think at times people forgot who they can reach out to, right? People were working or not working and so busy taking care of what they had to do to survive that they didn't really always reach out to the support system. So sometimes it's to remember that, take a pause and make sure you're reaching out to whoever your support system is. And understanding it's okay to need more help. It's okay. It's okay to reach out to say, you know what, I need someone to talk to. I was at a routine dentist appointment recently, and the woman who was cleaning my teeth was so nice. I told her what I did. She said, you know what? I know everyone was in therapy this year. We all needed it. We all needed some extra support. And it's okay. It's okay to say, you know what, I need something extra. And this isn't, I'm a therapist, but it doesn't have to be therapy necessarily. It can be something, whatever makes you happy, right? Whatever you feel will help make you feel good. Something else is setting healthy boundaries, right? So if there is someone in your life that you feel like I just don't have the energy for, it's okay to say no appropriately. It's also okay that if, to say no sometimes, to say no to your work, to say no, you know what, I can't take that extra meeting. I can't take on that extra individual person served. It is okay to set that boundaries. Next slide, please. This is also related to doing Zoom, right? Understanding when to sign off. I worked with a lot of individuals who, because they were working virtually, they were constantly answering emails at 9 o'clock at night. I was guilty as well. It's there. I got my phone. I can do it, or I'm working past my hours. I don't have a ride home. It's okay. I can work the extra hour, make it up. It's okay to sign off. Those boundaries are important to keep your mask on, to keep you safe. Understanding if you are doing virtual work and you're still doing virtual work, what some of us are, is do you have a separate place to do it? People who know me know I used to work in my basement a lot. And you know what, that didn't work for me. And it didn't make me, I was like, I can't be in here another second. I had to switch it up. So I think that understanding, even leaving floors, was important, and understanding where and how that is. And even still, how do we connect with people in a safe and appropriate way that makes you comfortable? I saw this a lot this year, understanding what you can and can't control. And I work a lot with people I serve about, here's what you can and can't control, right? I can focus on my attitude, turning off the news. I can find fun things to do. I can limit my social media. I can't, if someone else isn't wearing a mask or not, I can't control that. I can't control how this other person is going to react and target. I'm not sure how much longer there's going to be any social distancing guidelines or anything on the news about the extra variants. I can't control that. Next slide, please.
One moment, Lauren.
Yep.
Thank you.
You're welcome. I have to pre-apologize. My child is crying in the background, so if you hear them. So what is Advocates Community Counseling? We have 4 outpatient clinics: Harvard, Marlborough, Framingham, and Waltham. Our biggest clinics are in Marlborough and Framingham. We're a group of individual mental health counselors, social workers who work with people throughout the lifespan. We have over 60 clinicians with various specialties. We have people that work with children, adults, people with substance use issues, trauma, depression, anxiety. We have groups. We do individual and couples therapy as well. We have Spanish and Portuguese clinicians. We have a whole team of Spanish-speaking clinicians, and we're creating a Portuguese one as we speak. We have ASL, American Sign Language translation, and we have an intern starting that uses American Sign Language in the fall. And we have Japanese and now Mandarin available. This slide actually shows you how quickly things change. We're about 80% telehealth. However, we have started some in person on a limited basis. Access to care is very important for us. So we work with you individually on a one-on-one basis to try to get you in as quickly as we can. And we work closely with Shannon's team, and they're wonderful. So, and here's the number for crisis support. And thank you, everyone.
Thank you so much, Lauren. Our next presenter is Jeff Wolfsberg, Director of Recovery and Peer Support at Advocates. Jeff?
Thanks, Lauren, for that really great synopsis of some caretaking techniques, especially through the pandemic. And thank you, Shannon, for inviting me to this presentation. I'm excited to share what peer support does at Advocates. As many people may already know, Advocates is a very large agency. We have well over, I think, 1,800 people. And I believe peer support is one of the largest teams, if not the largest team at Advocates. Peer support consists of a couple of different positions. There is peer specialists, there's recovery coaches, and family partners. The one thing that unites all of these positions, especially the peer specialist and the recovery coach, is the common bond that we all have personal lived experience with a mental health diagnosis or substance abuse diagnoses, or in some cases both, like for me personally. Tonight you'll hear a lot from my fellow clinicians who offer great value, but peer support is a very unique and different way of approaching people in terms of providing compassionate care. The common bond of peer support is our lived experience. That is our expertise. Although we are well trained, there's extensive training that goes on both for recovery coaches and peer specialists with exams and certifications. Our expertise does come from our life experience. Peer support is one person supporting one person over that common bond and that mutuality. And mutuality is a very important word to us in peer support because it indicates that there is an equal sharing of power. And in many cases, it's our desire to eliminate any aspects of power. Power, from our perspective, can be things like writing clinical notes, in which we do not do. When you're able to write a clinical note about someone, there's a differential in the power balance. We don't look at people's clinical charts. So when I meet somebody for the first time, I know very little about their background. We don't walk around with name badges when we're supporting people in public or carry around keychains. We don't have the authority to section people. So we are trying to always establish a sense of a level playing field between the peer specialist or the peer support worker and the person. We believe this mutuality creates the best chance for a sharing that can go on that is healing for the person. And that's something I'm really passionate about, and very excited about being able to share that with you guys tonight. So one of the resources that we've made that's available in the community in Framingham for people during the pandemic and on is our crisis center called the Living Room, located at 284 Union Ave in Framingham. The phone number is 508-661-3333. The living room is a place where people can go as an alternative to traditional places to go when you're in a psychiatric crisis, such as the ER, or reaching out to the police. And in some cases, PES, what we call Psychiatric Emergency Services at Advocates, although we collaborate often with PES. So what is the living room? The living room is a warm, friendly, inviting environment. It looks just like, we try to make it look like just a home. You do not have to call ahead and make a reservation. You can just arrive at the door in any form of crisis that you feel like you need support with. And you will be greeted with a welcoming face and invited in 7 days a week. We're open 24 hours a day, all year long. The living room is completely peer run. There is no nurses or clinical staff on site. We do have some guidelines we like people to follow, such as we don't administer medications on site. People need to be able to take care of their own things when they're there. So there are some what we call entry agreements that we have for people to come there. But what can you expect when you arrive at the living room? You can expect to get flexible, compassionate care. If you just need to sit on the couch for a few hours and just talk to somebody who really understands what you're going through because they have been through it themselves, you'll get that. We do other things at the living room as well. We help people coordinate housing. We help people with employment if they need help with that. We help people find treatment. Last week, we were able to help 2 people get into substance abuse treatment, and we actually drove them there as well. So that was really a real positive experience. The living room looks like a living room. It's like anybody's home. It's a welcoming place. We also believe strongly in the ability for people to have choices. So traditional avenues for psychiatric crisis care is very restrictive, generally speaking, and oftentimes takes away people's ability to make choices for themselves. So the living room is a place where people can make up their own minds what is best for them, and we'll support whatever they think that is. You can call and receive support from the living room as well. The 508-661-3333 number is not just informative. You can call and receive support over the phone. When the pandemic started, we responded rapidly by establishing virtual peer support groups. Those groups are still up and running, and we expect to maintain those groups even after the pandemic is over. We have general peer support groups, Tuesdays and Thursdays at 9 a.m. and 9 p.m. We have 2 support groups we've been doing for years live, but we'll do them virtually and live going forward. One's called Alternatives to Suicide. The other is Hearing Voices. We have an LGBTQ plus peer support group, Black and Brown peer support group, and many others. And you can find the list of those virtual support groups on the Advocates website, or you're welcome to reach out to me and I'll provide you with a list. So we aim to build community at the living room. We aim to build community within the peer support groups. And it is a wonderful community. I pop into the virtual groups often so people can meet me as the director and ask questions, and oftentimes give me a hard time about things they want to be done differently, and that's why I'm there. But I think the living room is an important part of the peer support team. There's so many different things that Advocates does, and peer support is embedded throughout those different what we call service lines in Advocates. We have peer support and recovery coaches working in our what's called BHJI program, which is people coming out of the criminal justice system. We have people working in deaf services. We have people working in our largest service line, which is called ACCS, which is a program that supports the Department of Mental Health. But we are growing, and it's exciting. So right now we have about 53 on our team. So it's a big team, and the living room is a big part of what we do. So I really appreciate the time to share this information with people in the community of Framingham. And if you have any questions, please reach out to me.
Thank you so much, Jeff, for sharing what's a really unique and also important resource in the living room and the virtual support groups. I think that not a lot of people are aware of, so thank you. Our next presenter is Sandra Beatty, licensed mental health counselor and the program director for Framingham's outpatient treatment program at Spectrum Health Systems. Sandra?
Thank you, Shannon, and thank you for having me on to give some information about Spectrum. So I first wanted to just talk a little bit about the impact that the pandemic has had on patients who have struggled with substance use disorders and mental health disorders. It's really been very challenging. We've seen an increase in overdose, increase in mental health symptoms, depression, anxiety, as well as an increase of suicide ideation. And that has a lot to do with some of the isolation that's gone along with this. So it's super, super important for us to have as much treatment options as we can have available. So Spectrum really does a lot of same-day admission services, and we really try to have access for patients really on a daily basis as needed. So as a company overview, Spectrum is a not-for-profit organization founded in 1969 in Massachusetts. We are one of the leaders in addiction treatment for over 50 plus years. We have 1,200 plus employees. We run in 4 different states, primarily Massachusetts. Next slide. Thank you.
You could
so our
pause just a
structure-
moment, Sandra.
Yes.
Yep. Thank you.
Okay, so our organizational structure, we have 4 separate areas that we primarily work in. We have the behavioral health services, we have which encompasses our inpatient, outpatient, and peer recovery supports, which I'll talk a little bit more about. And these are funded by DPH, commercial insurances, as well as Medicaid, Medicare. We also have the New England Recovery Center, which is primarily an inpatient detoxification and inpatient rehabilitation center, and that's primarily for private pay and commercial insurances. We also have adolescent services, which are funded by the DYS, which are primarily residential services. We also have services through the corrections, so the state DOC contracts in prison and community corrections. We've also recently established outpatient treatment programs within the walls of the prison, which is new, and it's allowing for medication-assisted treatment while people are incarcerated, which is super important. Next slide, please. Okay, so to start, our inpatient locations are in Westboro, which is one of our main treatment campuses. We have programs for both men and women. We have the Spectrum Detox, which is services usually up to 7 days. We also have the Spectrum Clinical Stabilization Services, or otherwise known as CSS, which provides treatment for patients, inpatient treatment for usually between 21 and 28 days. We also have a residential treatment program in Westboro that anywhere from 3 months to 6 months, depending on the need. And we also, again, have the New England Recovery Center, which is for private pay and commercial insurances, as well as they have a detox as well as a treatment center residential program. We also have a facility in Weymouth, which is for men only, and that's a detox, CSS, and residential treatment. Next slide, please. So we also have 15 separate outpatient treatment locations, and they're all listed up on the slide. The one that I'm going to focus most on is Framingham, because that's what we are, primarily doing. But we also have many places in the area. If someone is in other areas, we have Great Barrington, Haverhill, Leominster, Milford, Millbury, North Adams, Pittsfield, Saugus, Southbridge, Waltham, Weymouth, and we have 3 separate locations in Worcester. And one is a rapid access program that has pretty much daily open access for medication-assisted treatment. Next slide, please.
Thanks, Senator. One moment. Thank you.
Okay. So I am the program director for this Framingham Outpatient Treatment Program, which is located on 68 Franklin Street in Framingham. So we primarily focus on mental health and substance use counseling, MOUD services, which is medication for opioid use disorder services, which include methadone and naltrexone, or Vivitrol, which a lot of people know that by. We have a lot of same-day services for the methadone and for the Vivitrol, as well as the mental health. So for methadone services, which is methadone is a medication for opiate use disorders, we have same-day admissions on Tuesdays starting at 6 a.m., which patients have the ability to, on that morning, call in to our intake and get an immediate spot that day. And from that day, we set them up. They meet with our doctor, they meet with our nurses, they meet with the clinician. They are set up for their, groups and counseling that they'll be receiving while on the program. And they will actually receive, if medically appropriate, a dose of methadone for that day, which is really nice because in other circumstances, you might have to wait several days to be able to receive that medication. And it's super important to be able to manage the withdrawal symptoms for opiate use disorders. Is that really what often drives the continued use? So the fact that we have the same-day admissions is really helpful for patients to be able to get the services, right away. Framingham does Tuesdays, and a lot of our other programs in the area do different days. So even if you can't get it in Framingham, you may be able to access in Worcester and Waltham on a different day. So in addition to the treatment for methadone and not Suboxone, but for naltrexone, which is Vivitrol, we also have same-day admissions for mental health and substance use counseling. And that's also on Tuesdays. It's just in the afternoon. We've decided to do it all in one day. So our whole day is full of admissions. Again, patients can call our intake line really at any time up until noontime to see if there's availability. We usually, very rarely do we turn people away. It's rare that we turn someone away. If not, we'll try to get them in soon after that. But we will provide same-day admissions where they come in, they get their screening done, they have an initial diagnostic evaluation by a clinician. If they're looking for naltrexone, which is Vivitrol, they will meet with our nurse. They'll learn about the different labs they may need, the different requirements that really are needed to be able to be on naltrexone services. And we get them started right there and then on that day. So they're already there, they're connected. They also may be connected with our RSN, which is called a Recovery Support Navigator, which we have available, who can also provide connections within the community for housing, transportation, other types of, different things that the patients may need that are more case management type services. So we, really tried to have, again, that admissions that are immediate. And on our regular daily basis, the Framingham Treatment Program offers daily medication for methadone. So we're open every day, pretty much every day of the year. The only time we ever close down is if there's a blizzard and Department of Public Health allows us to shut down and we give everyone medication for the next day, but we are open every day. We dispense methadone from 5:30 a.m. until 5:30 a.m. until 10:30 a.m. And so we have contact with our patients on a daily basis, which is nice. So they have someone to connect with. And during the pandemic, that was really important for a lot of the patients who were struggling. Next slide. Thank you.
Just one
So,
moment, Sandra.
yeah.
Mhm. Great, thank you.
Thank you. Okay, so we also have what are called peer recovery centers, which similar sounding to what Jeff was talking about, a little bit different, but they're peer recovery centers. We have one in Worcester called Everyday Miracles. We have one in Marlborough called the Recovery Connection. And we have one in Lawrence called New Beginnings. And so the peer recovery centers are basically centers for patients to go that are peer led. It's free, volunteer driven services and resources for adults at varying stages of recovery. They include support groups, recreational activities, social events, volunteer opportunities, and a lot more. And we hear this from patients often. They come back from doing, they'll have a bus ride out to Hampton Beach for the day. They'll do open mic nights. They have a lot of different fun activities. They'll have like jewelry making, which really does open up that really important, as Jeff was saying, the real peer support, which we have really found to be super important part of recovery for all of our patients. So we really encourage that at Spectrum to really become part of some type of peer recovery center. Involvement with others who are experiencing similar situations is super valuable. Next slide. Okay, so there is our main number that you can call for really any of our services that would, put you to where you need to be. And the separate numbers for our inpatient services, outpatient services, as well as the New England Recovery Center. And I think that's it. Thank you so much.
Thank you so much, Sandra. We know that the pandemic has been so difficult on everyone, and particularly those that struggle with substance use. And it's great to have some resources to share with people to help either get onto the path of recovery for the first time or to get back onto the path. So thank you.
Thank you.
Our next presenters are from South Middlesex Opportunity Council, SMOC, and they will focus on behavioral health and social service resources. They are Joe Fletcher, licensed mental health counselor and director of community support services, Leslie Lee, director of program operations, and Susan Morley, doctor of psychology and associate clinic director.
Thank you for having us. This is just great to be able to share information. My name is Leslie Lee, Director of Program Operations. Tonight, we're going to talk about many of our services at SMOC. There are many. SMOC is a multi-service agency, nonprofit agency, and tonight we're going to talk about a few things. I'm going to start out with talking about our Common Ground Resource Center. Our Common Ground Resource Center serves as a hub for all housing and shelter referrals for single adults in the Metro West. We do an assessment process, an intake form that is filled out with important information to best triage and serve the individuals that are looking for services. We have the number up here that anyone can call, providers, the individuals themselves, and also a fax number. Once we get that referral form, that assessment form, we have a triage meeting and we, triage whether a shelter is a good fit or if they're housing or whatever their needs may be. As I said, we're a multi-service point of entry for single adults. So sometimes it might be employment. So we have a workforce development program at SMOC, GED, HiSET, and ESL. We do food pantry referrals. We do SNAP referrals, SMOC housing, as well as we do street outreach and a drop-in center for single adults. We go out into the community to make sure that people that are living rough or are homeless, that we can provide them with services and possibly get them into our shelter. So these are our shelters that we have in the Metro West. Turning Point is a 24-bed for men, and there's no sobriety required. In that shelter, what we do is we do case management. So when a gentleman comes in for shelter, we have a case manager that works on many things. It could be recovery programs, it could be employment, it could be housing. So whatever the assessment says that they're looking for, we try to work on that. Roland's house is in Marlborough, and it's 18 beds for men. Sobriety required, but we definitely work around that sometimes. But we try to, work on their sobriety. There's lots of services that we have in that area that the men there access. And Shadows is our women's shelter. It's an 18 bed for women, 10 sober, 5 low threshold, and we have the upstairs of Shadows is Meadows, and it's a 10 SRO, single room occupancy units. So these are our shelters that we work with. And what we do is once people are in shelter, we work as a team to try to get them housing. And Joe Fletcher is going to talk a little bit about the housing that we have once someone leaves shelter and goes into housing.
Thanks, Leslie, and thank you, Shannon, for having us. Good evening, everyone. My name is Joe Fletcher. I'm the Director of Community Support Services at SMOC, and I can talk a little bit about SMOC's extensive affordable housing network. We do have many units for children and families, as well as single adults across central Massachusetts from the Merrimack Valley through Metro West into the Blackstone Valley and even out towards Springfield. This housing is recovery-focused housing for people who have recently been in a detox or an inpatient level of care and are ready to try sober living. We also have low threshold housing. Many of these units use a housing first model. We'll talk a little bit about that in the next slides. And we have affordable housing. Many times this is called a rooming house. So these are single room occupancies where single adults will share a common living area like a kitchen and a living room. And most of our housing is called supportive housing, which means we have case managers who help to stabilize our tenants and provide them with wraparound care. When an application is made to the Common Ground Resource Center that Leslie just spoke about, many times it's accompanied by a housing application. So if yourself or one of your loved ones, or if you're working with someone who is looking for housing, if they're experiencing some instability, maybe caused by the pandemic, and they want to make an application to SMOC housing, they will need to complete the housing application, have a copy of the photo ID, a copy of the birth certificate. They'll sign a query request form so we can do a background check. And the property managers will also require a proof of income, which can usually come in the form of pay stubs or sometimes the Social Security or Disability Award letter. The support services we have are quite extensive. They're based on an assessment by a multidisciplinary team. We meet twice a week to review all of the referrals, and that team is comprised of property managers, case managers, recovery coaches, care coordinators, behavioral health clinicians, employment specialists, and we all decide what would be the best milieu for a client, and we place them as such. We do have programs for the chronically homeless. We have programs for high utilizers of services. And we have programs for people who have never faced homelessness at all. So we have something for everyone. I would like to think that we can provide this high level of care to anybody that comes through our doors. The community support services programs really serve the chronically homeless and the high utilizers of services, and the goal is to retain housing and prevent another homelessness episode. So we get those referrals from the shelters, hospitals, and managed care providers, but anybody can come in and fill out the assessment and apply for these programs. Most of these care management services are funded by Mass Health. The goals for the program are to enhance daily living skills, to promote financial stability through workforce development and employment training, as well as access to mainstream benefits. We develop crisis plans, and we ensure that people are connected to outpatient providers like their primary care doctor and behavioral health clinicians. So I'm going to turn it back over now to Leslie again to talk a little bit about HCEC. Thank you.
I'm back. Hello, everybody. So our HCEC stands for Housing Consumer Education Center. And I would say this is, all our programs are important, but this really gives a lot of education, a lot of referrals, a lot of information. So the services that we have and some of the workshops that we do, some of the topics are general housing information, affordable housing, housing search, tenant landlord rights, utility shutoffs, evictions, EA shelter denials. So when someone applies for shelter and they're denied, sometimes people come to us and we can help them with those denials. Foreclosure prevention, home loan modifications, furniture bank referrals, and food pantry referrals. We also have a first-time home buyers class, and it's been via Zoom. And I have to say that enrollment has been up because it's been in Zoom, because usually they would come to the building, but now they can do it online. And it's been a lot more people have been coming. We also have financial literacy via Zoom, budgeting, and credit. I will say this department, the education piece, I feel is so important. People come in for financial services, maybe they're behind on their rent, they're behind on their utility bills, and we are able to kind of give some education on top of giving some financial services. And it has been instrumental in helping people. Sometimes people don't know that if you're behind on your rent, the worst thing to do is not to talk to your landlord. Sometimes you want to avoid the landlord, but it's really important to keep that communication going. So that has really been such a great resource for people to have that, that information and that education. Can do next slide, please. So this is our RAFT program. So I know Roz Baker is going to talk a little bit about RAFT and how she helps out, but this year during the pandemic, our HCEC department has been very, very busy all the time, but especially this year, people losing their jobs, people not being able to work because of childcare issues, or being furloughed or laid off. So our RAFT and our IRMA, ERAP financial services have been instrumental in helping people. We have already this year spent $5.5 million in helping people stay housed or helping them move to other units if they were out of their unit or homeless. So this is some information of how to complete so either RAFT, IRMA, or ERAP application. And I will, it's very, at SMOC we have, and the state, we have so many acronyms. So RAFT stands for Residential Assistance for Families in Transition. And that's a short-term subsidy to help people stay, helps with first, last security and some stipends. And it goes by income, but many, many people are qualified for that. IRMA is also another financial assistance program we have. If someone doesn't qualify for RAFT, they may qualify for IRMA. And that is for people that have struggled during the pandemic. And we had a new program this year, is our ERAP, which is a federally funded program that helps people. And it actually goes up there. The AMI is higher than RAFT and IRMA. So a lot of people have qualified for that. So we have the website. We also have our email for HCEC if anyone has any questions, or we have a hotline number that, they get back within 24 hours if someone calls and has a question about either being behind on their rent, being evicted, needing to move into a new place, and they get back to you within 24 hours. So this has been a very, very busy department this year and has helped many, many people. Next slide, please. Here's some more information. I don't know if that was just on the last slide. We might have two slides that are almost the same, but this is, so everyone there's so many ways to access the HCEC department. The HCEC department will also help with any information or referral questions. If someone is looking for shelter, if someone is looking for, we actually had someone that was looking for health insurance or insurance for their cat, and we were able to help. So really, it's a place that you can go for any question, and we try to find the answer. That's our motto. You come with a question, we come with an answer. So we don't want to leave anyone without an answer. So that this is the way to get a hold of that department. And there's phone, there's email, there's website. So everyone should be able to access this department at SMOC. And I'm going to now hand it over to Susan Morley.
Thank you, Leslie.
You're welcome.
I always forget what HCEC stands for myself. Anyway, I'm representing the behavioral health clinic and the various services that we have in the Division of Behavioral Health, primarily our mental health clinics, our residential programs, and the other two programs that you see on the slide. I think that Lauren and Sandra did a lovely job describing what kinds of programs, whoops. Anyway, yeah, there we go. I did a lovely job describing what kind of programs and what kinds of things happen for outpatient care. We have a clinic in Marlborough and Framingham, and we work with ages 3, actually 2 and up probably, to older people. We have Spanish, Portuguese. We have a Russian speaker right now, an Albanian speaker, and someone who speaks Urdu coming in the fall. So we really try to meet some of the language needs of the people who come to us. We have groups, we have individual, we have family work. We do in-home behavioral health work with children and families, children and family behavioral initiatives. So we are, that's the biggest thing we do, but we also have 4 residential programs, and those programs stayed open the whole time during this pandemic. It was a challenge, and at this point, I'm highlighting them a little bit because all the residential programs in the state seem to have openings right now, and we do too in most of these programs. I'll talk about the Recovery Center and the peer recovery coaches at those slides. Next slide, Nick, please. Our 4 residential programs are here: Sage House, Serenity, Co-House, and Rhodes House. The first 3 are located in Framingham, and Rhodes House is located in Millbury. They all have something different to offer, and they all have, I believe they all have openings right now in case somebody wants or needs long-term residential recovery services for addictions. Our Sage House program is the only program in the state that is focused on a male head of household. They can bring their children and their significant other, or just come on their own with their children. It often involves reuniting, a chance for families to reunite with their kids, and they stay probably around 9 months. They do recovery work, they do parenting work and family work, and it's a tall order all in one place. We also have Serenity and Co-House, which are in downtown Framingham. Serenity is for about 36 women. We have 5 or 6 beds for pre and postpartum women. So there's babies at that site. And upstairs from Serenity House is the Co-House, which is the coexisting disorder. So it's women who have found it difficult basically to be in other recovery homes. They have coexisting problems such as traumatic brain injuries or schizophrenia or FAS, problems that have made it really hard for them to follow the sort of more general rules of a Serenity House type place. And so the treatment is more individualized. Rhodes House is a social model residential program, meaning the residents have a lot more say in how things get run there, and that's in Millbury. And I know that it has openings right now. So if people are interested, or you know people who would like some residential treatment, 6 to 9 months, depending on the program. I think it's a good time. I hear around the state that there's a lot of openings since there's so many housing options suddenly open to people. There's, maybe that's a part of it, I don't know. Because we know that addictions have not gone away during the pandemic, that's for sure. Next slide, please. Right at the beginning of the pandemic, we were just about to open our Framingham Recovery and Support Center, downtown Framingham, right next to where Salvation Army used to be. And it's now open, fortunately, but it took a real right turn. You know, we had to change everything about how we were doing that program. Anyway, it's a recovery program similar to the one that Spectrum runs, but this one is in downtown Framingham. It's a peer-led recovery support service with volunteers and members to deliver services, to create programs, to decide what each recovery center tries to decide and create what it is they think they need in that area. So it can be social, it can be recreational, it can be support. We have groups on Zoom now, even though the building is open. There's women's support groups, healing from trauma group. They're doing smart recovery groups, groups for everybody. They have a whole range of programs and different languages represented as well at the Framingham Recovery Center. Next slide. Oh, these are the ways you can be in touch. They have Facebook. Unfortunately, I don't know what happened to the slide about recovery coaching. I thought I had one, but it doesn't matter. Our recovery coaches, I thought that Jeff did a lovely job talking about recovery coaching. And so we also have recovery coaches like some of the other programs do. We have 3 people who have lived experience and are eager and willing to work with anybody who wants to have that extra support in their life. Could be daily, could be weekly. Some of our recovery coaches try to run groups and provide support for folks who are in recovery and want to stay that way and know that weekly counseling isn't enough for them. That's my short and sweet presentation. Thank you.
Thank you so much, Joe, Leslie, and Susan for all of that great information.
Shannon, could you pause one moment? I think we have to adjust the spotlight real quick. Thank you, Shannon.
Sure. Our final presenter for this evening is Rosalind Baker, Master of Public Administration and Program Director for the Framingham Family Resource Center at Wayside.
Hi, everybody, and thank you guys so much for having me today. I'm going to talk about our resource centers at Wayside. Next slide, please. So there's 2 resource centers within Wayside. One is the Family Resource Center, where I'm the director, and the other is Tempo, and it's a young adult. It's a young adult resource center, and they have a plethora of programs that we can talk about. Next slide. So when people come into our resource centers, they can expect Wayside support centers to be treated with kindness, empathy, respect. We accept referrals from any place. It doesn't matter. We take them. We most likely get them from schools, courts, and other community agencies like Advocates and SMART. So I want to kind of touch base on like what happens when you come into this resource center, because we do an assessment. Can you go to the next slide? We do an assessment when people first come in, just to see what the crisis is. In March 2020, wow, everything just shut down, completely shut down. And families were not prepared, just simply not prepared at all. So we stayed open the entire time. So we were doing applications for things like basic needs. Food insecurity was huge. There's all of a sudden the kids are home. We would virtually, and people came into the office, and we would assist them and apply for SNAP, finding out where the food pantries were, signing up for delivery of food, and just trying to get supplies for them. Now we know all about the supplies issue in March, so we were able to get some supplies from our Sodexo, which works with our campus, and we ordered our stuff through them, and we were able to supply these things to families. Housing, Leslie talked about it. It's huge right now. People are trying to pay their rent, trying to pay back rent. They're very, they're scared. They don't know what's happening. So we do help them fill out those applications. So Leslie showed you the portal for RAFT, which is actually the portal for all of those programs she talked about. So people are able to come to us, and they get a pad, and we kind of walk them through how to apply for the RAFT. They often are concerned they're applying for the wrong program, and I said, nope, there's one point of entry. They will figure it out. Let's just get your application in. So we have something in that you can tell your landlord you're trying to get here. So we were able to do that with families. We did applications for unemployment. We did that all. That was March through about April of 2020. That's all we did. I can tell you just about anything about unemployment. So we take care of the basic needs, and that's done when they come in, when people walk in the door. The other piece that we do is that we have a unique tool that we can use. It's called a family needs assessment. So just a little background on family resource centers. They came about with the change of the CHINS law, which was child in need of services, and it shifted to child requiring assistance. And that shift, what that shifted, the courts and the clinicians weren't just focusing on the kid; they were focusing on the whole family. So that using that philosophy, we are trying to keep kids out of systems like DCF in the court system. So our family needs assessment is assessment that's done with just what it says, with the family. Sometimes we have to do the assessment with each member of the family separately, depending on what's going on. But the assessment is done by a licensed clinician. We work with a family partner, and then we have school liaison. So if this is coming from school, the school liaison joins this team. The uniqueness about this is that we sit down with the family and we ask them what they see, where they see the issue, and each family member may see it differently. So we will sit down, do the assessment, and this is their plan. So we work with them, and they're involved in the entire process. This is their plan, and that's why we're able to see and avoid crisis. Give the parents a safety plan to work with, and make the decision of where we're going to refer them. So typically we refer to CBHI services, which are services for families that are in crisis or just need support, and they stay involved until they stabilize. I know Jeff mentioned the importance of lived experience. I can't tell you how important that is when it comes to a family and our family partners. They walk with the parent through whatever they need to get them to where they're going to till they can stabilize with their kiddo. Their philosophy is do for, do with, and then cheer on. So when you first encounter a parent that's struggling with a kiddo, that's when you're doing for. As you go through your journey with this family, you have them do it. So you do it with them, and then at the end we cheer them on. That's their next step, and then the stabilization. So I can't say that enough about the importance of lived experience. Again, we try to take care of the basic needs first, and then we move on to the other stuff. And after the family needs assessment is done, we are able to refer them to different programs that we have within the resource center. Some of the programs are evidence-based parent groups. There are different types of groups. We have groups that are parent groups that take a look back as a reflective group. You take a look back at how you were parented and how that is affecting your parenting today. The other groups are skill-based. We have support, then we just have support groups for parents. And we have all sorts of other kinds of programming. We did a group called Healthy Warriors. And that was a group that we did over the pandemic, virtually. All our groups were held virtually at that time. And they will continue to do because we get better attendance. I don't know why we didn't think of this before, but now we're able to meet people where they're at, really. We have clubs for little kids. We're trying to restart because we want to have them in person when it's nice outside. They deal with anxiety in kids. We have groups that are dealing with kids that have parents with an SUD, substance use disorder. So all those sorts of things. We also have events that we have with ice cream truck come. We have cookouts. We do a lot of civic event engagement where not last year, but the year before, we had voter registration drives. We had candidates come to our office and meet with families and young adults. So that's what we do at the resource center. Can you go to the next slide, please? So Tempo, this is a young adult resource center. Again, they deal with the kinds of basic needs that kids need. They do actually have apartments as well that kids can access through DMH or DCF. So they do have a kind of a residential program where the kids live on their own and they support them. So, but for basic needs, what they do is that at Tempo, there is if kids are homeless or they need to do laundry or things like that, Tempo is the place to go. They have a place for kids, for young adults to be able to wash their clothes. There's a shower if a kid needs to take a shower, who's maybe a kid who's couch surfing. They can take a shower there. There's the kitchen's there where they can cook if they need to. They can we have a full kitchen with an oven, a stove, microwaves, everything. Then we have a food pantry, so they can also take a bag of food home. So just like the resource center, housing is probably the #1 issue for young adults. And we also do at Tempo education. There's all sorts of educational components to it. They can help you find a GED program. They do skills inventory to figure out what type of job you think you would like to do. There's a computer lab where they can look for jobs. There's a computer lab where they can do their GED prep on it. They also have a computer lab for them just to be able to hang out. They have a chill zone upstairs. I can't say enough about Tempo. And then also employment. They do a lot of employment with young adults. helping them do resumes. Again, trying to figure out what they want to do with it, what they want to do for the rest of their life. Because the worst thing in the world is to get up and go someplace where you hate every day. So we try to tell them to really look deep and see where your interests lie. They have all sorts of grant funded programs like I talked about. They partner a lot with SMOC. This program is, again, a drop-in program. The other thing I don't want to forget is that there is a licensed therapist that will see the kids as much or as little as they want. They make the appointment, they drop in. And so that's available to them. A lot of times when kids are that are age out, and then we get a lot of the kids that are aging out of a system, whether it be DCF, DYS. They will come and they're like, I'm all done with that. I've been doing it all these years. And this just gives them a little place where they can go if they feel like they need the help. And there's 4 case managers at Tempo that work with the kids. Again, it's a drop-in center. They do everything from housing, food, medical, doing medical applications, getting kids on either Mass Health or on their parents' insurance. They're estranged from their parents, but they're trying to access the insurance. And the case managers are wonderful. We do have Portuguese and Spanish speaking staff. So we do have the ability to work with families who don't speak English, and we do a lot of things around immigration safety with the families and the kids. There's no cost for services at the FRC or Tempo. Groups are free. We do I forgot to say this. Tempo does a lot of guitar lessons. They do a lot of art for kids that are interested. And we have a LGBTQIA plus group for kids, and we have one for their parents. And the parent group is done through the FRC, and the support group is done at Tempo. So it's we have a really nice synergy together. I think that's it. I'll give you the next slide. So I am the director of the Framingham Family Resource Center, and Troy Fernandez is the director. Our phone numbers and emails are here. Please feel free to reach out to us. We're here to really help the community, especially coming out of this pandemic. It's we're cautiously hopeful that we're out of it completely, but we're just here to support the families and young adults.
Thank you so much, Roz. Could you also just quickly mention the ages? I know you said young adults for Tempo.
Oh, yes.
But could you specify the ages? Because I think sometimes people don't always know exactly what age ranges that constitute.
It's
a broad range.
Yes, 17 to 24 is Tempo. And any age is at the, I'm sorry, 17 to 24 for some grants, 17 to 26, I believe, for others, for the drop-in. But and the Family Resource Center is for families with kids.
Thank you so much. All right, we are just about perfect on time. So thank you to all of our presenters this evening for sharing such great resources, and to our interpreters for making tonight's presentation and all of the resources shared accessible. Thank you again to the City of Framingham for their sponsorship of this presentation. And as a reminder, we'll be sending out the slides to everyone and also making the recording available to anyone that's interested. Please feel free to take a moment to take down any of the resources here if you'd like to, but again, we will send everything out. Have a wonderful rest of your night and take care, everybody.